Have you ever just stopped and really thought about the process of birth? I mean, it's one of the most fundamental things we all go through, a journey every single one of us has taken. Well, today, we're going to follow that incredible path, step by fascinating step, to see exactly how a normal, uncomplicated labor actually works. So, how does it happen? How does a baby make that incredible journey into the world? It's not as simple as just finding the exit door. It is this complex, beautifully orchestrated dance between mother and baby, a true biological marvel. So let's start at the beginning. Okay, so before we can really dive into the journey, we kind of need to understand the map, right? We have to know what we're talking about. So what exactly is normal labor? Let's define that starting line. The official medical term is Eutocia, and it perfectly sums up the ideal scenario. Let's break that down. Spontaneous means it just starts on its own, no intervention needed. Full term means it's happening at the right time, usually between 37 and 42 weeks. It's for a single baby, not twins or triplets. And that baby is in the best possible position for delivery, head down. And, maybe most importantly, the whole thing happens without any major issues. So, these are the hallmarks we're looking for, the key checkpoints on this journey. You can think of them as all the green lights. Each one is a crucial sign that the process is on the right track and is all heading towards a safe delivery for both mom and baby. So, how does this whole thing get started? It's not like there's a switch that just gets flipped. It's more like an orchestra, waiting for the conductor to give the cue. The body has to get a very specific signal that it is go time. And that signal, it's actually a really complex mix of different triggers. It turns out there are two main types of go signals. On one hand, you've got this whole hormonal cascade. Hormones like oxytocin spike, which basically tells the uterus to start contracting. At the same time, progesterone, the hormone that kept everything relaxed for months, takes a nosedive. Then, on the other hand, you have purely physical triggers. The uterus is stretched to its absolute limit, and the baby's head starts pressing down on the cervix. That pressure sends a very clear message to the brain. Okay, we're out of room. It's time. But how do you know if it's the real deal? This is the classic question. Well, true labor contractions have a distinct pattern. They get stronger, they get closer together, and they don't go away if you change positions or rest. But the number one sign? They're actually causing change. The cervix is starting to open. False labor, what people call Braxton Hicks contractions, is more like a dress rehearsal. They're irregular, they don't get stronger, and they don't actually progress the labor. All right, so once labor has truly begun, the journey unfolds in four very distinct stages. You can think of them as four acts in this incredible biological drama, and each act has its own purpose, its own feel, and its own timeline. So, Act 1. This is all about preparation, and it is by far the longest part of the journey. The main goal here is for the cervix, which is like the gateway from the uterus, to thin out and open up completely. And this takes time, especially for a first-time mom. We're talking up to 14 hours, sometimes more. Patience is everything here. Now, this first stage has its own mini-acts. It starts off slow and steady in what's called the latent phase. Then things really start to ramp up in the active phase. Contractions get way more serious. And finally, you hit the transition phase. It's the shortest part of stage 1, but it is definitely the most intense, and it gets you right to that finish line. A great way to picture this is to think of a thick turtleneck sweater. The whole process is about that turtleneck first thinning out, that's called effacement, and then opening up really wide. And that is dilation. And this is the magic number, 10 centimeters. When you hit 10 centimeters, it means the cervix is fully dilated, the gate is officially open, all that preparatory work is done, and it is time for the main event to begin. Welcome to stage 2. This is the expulsion stage. This is when the baby actually makes its way through the birth canal. Now, the mother's role becomes super active. There's this overwhelming involuntary urge to push with the contractions. This is the final descent into the world. But here's something that is just absolutely amazing. The baby isn't just a passive passenger being pushed out. Nope. To navigate the narrow, curving path of the pelvis, the baby performs this precise, brilliant sequence of maneuvers. They're known as the 7 cardinal movements. Seriously, think of it like a key turning perfectly in a very complex lock. First, the baby's head engages in the pelvis and starts its descent. Then, it does this clever little chin tuck to present the smallest possible part of its head. Then comes a crucial move. It has to rotate because the shape of the pelvis changes. That turn aligns the head perfectly to pass through. The head then extends as it's born, and then it realigns with its shoulders so the rest of the body can just slip out. It's this perfect, necessary dance. So the baby is born, but the journey isn't quite over. We still have the final acts. Stage 3 is the delivery of the placenta, which usually happens pretty quickly, within about 30 minutes. And stage 4 is that first hour or two right after birth, a really critical observation period to make sure both mom and baby are stable, healthy, and doing well. Wow. So we've followed this incredible journey all the way from the very first signal to the final moments after birth. Let's just take a step back and look at the whole map one last time, just to recap. When you see it all laid out like this, you can really appreciate the rhythm of labor. I mean, look at the contrast. You've got the long, patient work of the first stage, the marathon part, which can take over 10 hours. Then that's followed by the intense, focused sprint of the second stage. And then you see the relatively quick third stage for the placenta. And finally, those crucial hours of the fourth stage, where recovery and that all-important bonding begin. It is just such a powerful process. Normal labor is, without a doubt, a beautifully intricate and efficient process. It's really a testament to nature's incredible design. But it does leave us with a really important question. What happens when this carefully mapped journey takes an unexpected turn? Well, that, of course, is a story for another explainer.